worried about was finding good partners, and Bill found us. We gave a talk, he tracked us down, he said he wanted to participate, and here you are. I just want to start by expressing my gratitude for that.
Well, it's wonderful to be here.
In spring 2011, Professors Jim Patell and Stefanos Zenios of the Stanford Graduate School of Business introduced a new one-quarter, project-based course focused on the design of innovative new service offerings. The first time the course was offered, it focused on healthcare, and specifically on the needs of pediatric patients with chronic conditions as they prepare to transition to adulthood.
Because of medical progress that was made in the late 70s and early 80s, for the first time in history, we have children with very serious medical conditions like congenital heart disease surviving into adulthood because of treatment they received when they were just born. So we reach out to our colleagues in the Children's Hospital and we try to learn from them. What are some of their big problems? And what if we would get a team of highly motivated, highly energetic graduate students to work on their problem for 2 months?
We want students to interact with real patients and real hospital personnel, from the surgeons down to the janitors, and learn how medical systems work and get a chance to design improved ones. And we want every partner to give us a real problem, something that really annoys them, and we want to solve that problem.
There's so much you can do to help our users through technology that is not expensive. There's a lot of low-hanging fruit with services. And so I think this course finally addresses that, and I think it's the right time.
The students taking the course formed interdisciplinary project teams to tackle a wide variety of projects. One team worked with the Pediatric Rheumatoid Arthritis Group at the Children's Hospital to evaluate how to improve communications between doctors and their patients.
We were initially assigned to look at basically creating a tool that young adults could use basically to record their own medical history, take that medical summary with them to their next as they graduated from pediatric doctor to an adult doctor. But as we talked with the doctors and also amongst ourselves, pivoted a little bit and tried to figure out, well, what is it that these kids really need? Also, we interviewed a number of patients about their experiences, both with rheumatoid arthritis and with lupus. And what we ultimately came to was something that we called iThrive, which is basically a health tracking app. So it had very little to do actually with sort of the particularities of rheumatoid arthritis or lupus, but in talking to the doctors and the patients, we realized that taking care of your sleep habits, taking care of a proper diet, taking care of exercise and things like that were some of the most important things in these kids' overall health. And if they could sort of take charge and understand what they were doing and how to improve that, then that might help them take responsibility more broadly for their care.
2 other teams partnered with a physician specializing in genitourinary reconstructive surgery.
As part of my role in the course, I was a physician partner, and what that entailed was providing the students with both problems within my specialty that needed some work from the service perspective and patient engagement perspective. Once we identified those problems, then it was going ahead and finding patients within those different areas of interest for the students to meet with and talk with. Once they actually accomplished that, then it was sort of gently guiding them through some of the medical aspects that they needed information on and help with as they came up with their solutions to the problems. One of the projects was based on urinary incontinence, adolescents who have trouble controlling their ability to hold urine in their bladder. And one of the problem points for them as they move on in the adult world is concealing the fact that they need to pass a catheter into their bladder in order to evacuate the urine and stay continent.
We looked at how we could take big, bulky, noisy catheters that were stigmatizing, caused a lot of anxiety, and making them smaller, more compact, and giving the user control over that situation.
The group of students innovated on a design for a catheter so people could do this in perfect concealment within a public restroom, a college dormitory, a workplace.
Part of the inspiration for this was actually a condom. So we thought of our particular user who was a college male and described the stigma involved with the conventional catheter falling out of his backpack. And we thought, well, if you're in college and a condom falls out of your backpack, it's not going to be thought of in the same stigmatizing way. So how can we turn a urinary catheter, a product that looks very medical, is somewhat off-putting to other people, and make it something that seems normal, cosmetic, hygienic, expected even.
The second project was actually more in the educational realm.
Our team was excited about working on testicular cancer. When we saw a presentation by one of the physicians who was partnered with the course about some of the severe effects of testicular cancer that occur when it's not diagnosed at the right time, we were very shocked, and we wanted to work in that area.
The group of student entrepreneurs that worked on this project tried to come up with an educational campaign to engage young men and young boys in learning how to recognize testis cancer and be a part of the active screening process. Both of the projects are still actively being worked on. The product for the catheter actually already has a provisional patent. They've actually had some funding granted both through the Children's Hospital and an innovations, pediatric surgical innovations group to sponsor prototypes. So that one's moving ahead very rapidly. The educational campaign, they've got the whole program for it together, and we're hoping to roll it out during the fall of this academic year.
In all three of these example projects, students were energized by the opportunity to collaborate with physicians and patients in solving concrete challenges.
The professors and the staff who put together this class put a lot of effort in setting it up in such a way that students can get a really meaningful experience. They put a lot of effort trying to maintain partnerships with real organizations and real people so that students are solving real problems.
And I think it helps if you are excited and get energized by the prospect of bringing serious solutions to really challenging problems that are going to serve people in the future.
This is a course where you can really make a difference. I think in 1 quarter, the potential for having an impact on healthcare is greater than the potential for any single physician at times to impact on healthcare. So it's a wonderful opportunity if you want to make a difference.
But I'd add, colorful Post-its, I think, are definitely a takeaway of this course.